Okay, we're back. I want to go over a couple of things that we just talked about as far as shifting between plans. So Mary's going to tell us about what if we sign up for a Medicare Advantage plan and we want to move back to traditional Medicare with the supplement. What are the deadlines to do that? If we sign up for Medicare and we haven't signed up for the supplement, how long do we have to wait before we get in trouble to sign up for the supplement? And then if we've signed up for the supplement and Medicare, traditional Medicare, and we want to go back, we want to try Medicare Advantage, how long of a trial period can we get on that? And if we don't like it, when can we go back to Medicare Advantage without a penalty? So I think we're going to cover those three. Those are most of the likely scenarios that seniors are going to be thinking about when they do this, right?
Right. These situations come up fairly often for those people that aren't fully knowledgeable before they sign up.
Right.
So I'm going to cover them very clearly. The first scenario is if somebody signs up for Medicare and they sign up for a supplement, and then they could be on a supplement for a year, 2 years, 5 years, and they say, you know what? I want to try a Medicare Advantage. I have friends that are on Medicare Advantage. They're paying $0. They seem to like it. I want to try it.
Right.
And they enroll effective January 1, which is open enrollment for a Medicare Advantage plan. But remember, they've had for a number of years the supplement plan. So they relinquish the supplement plan,
which is traditional Medicare.
Traditional Medicare plus the supplement.
Yeah.
You got it.
Yeah.
And they go on an Advantage plan. There's something called a trial period. It's like a touchy feeling. Let me see if we get along.
Right.
And if any time during the 12-month period that they started on the Advantage plan, they realize that it's not for them and they'd rather go back to the supplement, the original supplement company must take them back on the same plan that they were on before, no questions asked. That's federal law. That's number one.
Right.
Pretty simple. The next situation is when you sign up for Medicare and you go right into a Medicare Advantage program right away. You start off Medicare Advantage.
Right.
If you decide that Medicare Advantage is not right for you and you want to go ahead and sign up for a supplement, you have those 12 months to do it in. It's another trial period.
Got it.
Touchy-feely, see if you like Medicare Advantage.
Right.
If not,
without answering the medical questions.
No medical, right? These are all guaranteed.
So you're not going to get knocked out of a supplement program.
That's right.
Okay.
The third situation is, what if somebody just signs up for Medicare A and B and they don't take any action? All they have is Medicare and A and B. No supplement, no Advantage plan.
Hospitals and doctors, yeah.
Hospitals and doctors, exactly. Well, if they are within 6 months of their Part B enrollment, you can enroll in the supplement, no medical questions.
Okay, 6 months. You have a 6 months grace.
Right.
Got it.
You have a 6-month period that you can wait.
Okay.
The question is, are you within 6 months? So some people say, well, that's 3 months before, 3 months afterwards, but most companies honor the 6 months afterwards.
Okay, got it.
Or you can go ahead at any time. There's very little restrictions. Every January 1st, let's say you go 20 years without anything, and then you say, I want to sign up for an Advantage plan. That following January 1st, they'll take you. No problem.
Got it.
No problem.
Good. One of the things I had read was there is an organization that rates Medicare Advantage and Part D plans, a star rating, and maybe people that want to go into Medicare Advantage or are looking at it may want to access that rating system. It's
right. Those apply to Advantage plans and to Part D plans.
Right.
And it's basically a rating system, a customer satisfaction system.
Okay.
So I would say when you're looking at a Part D plan or an Advantage plan, the most important thing to look at is your doctors, that they're in the network. The second most important thing is to look at your medications, how expensive they are within that plan.
Right.
And the third factor I would consider, let's say you're down to 2 plans and all things are being equal, then I would look at what the public says.
Right.
Star ratings.
Right. And the star ratings are 1 through 5.
Right.
Yeah. And 5 being the best and 1 being the worst.
That's correct.
Okay. Good. Well, that's good to know. Now, we've thrown a lot of letters out. I mean, A is hospitals, B is doctors, D is prescriptions, C, confusingly enough, I think it's Medicare Advantage, right?
That's correct.
And then there's a bunch of Medicare supplement plans that have different alphabet letters. So maybe you could take us through the alphabet soup here.
Okay, alphabet soup. So on the screen, you may be able to see this presentation that I like to use. And the first page of the alphabet soup is Part A. So Part A is where we started our discussion about Medicare, and that has to do with covering your hospital charges. Okay. By the way, the government portions are called parts. The supplement is called a plan. So you'll see in a moment what I'm talking about. So you have Part A, and that refers to the hospital coverage. Then we spoke about Part B, which has to do with the government coverage of your physicians, your outpatient care, your testing, and your supplies. We spent some time talking about Part D, which is your prescription drugs plan. There's nothing, no materials on that. We just had a discussion on that. But we do have a page in our presentation that shows what the charges are based on your income for Part B and Part D. But Part D stands for drugs. That's your prescription drugs. And then the last document is a chart that has all these A, B, D, G, K, L, N, C, and F. These are all standardized Medicare supplements. So Medicare supplements are standardized by the government. Supplement G from Plan ABC versus Plan XYZ, they're exactly the same. These are all created by the government, and the insurance companies create these plans to match with the government specifications. So some cover more, some cover less. The plan that covers the most today is Plan G. That's the one that most people have. And there are others, and there may be reasons why other people may want to take other supplement plans, cost and things of that nature. But G is the most popular plan, and that's called Plan G, as opposed to Part A, Part B, Part D, Plan G. Now you threw out a term called Part C. Part C is nothing more than a Medicare Advantage plan, because what it does is it covers the expenses that you would incur under A, under B, and under D. It doesn't really make too much sense, but when you see something called Part C, it's referring to a Medicare Advantage plan. They're synonymous terms.
Okay. And these out-of-pocket annual limits on this chart, why do they, K and L, what does that mean, Mario?
Hold on, let me get there.
That's on the
K and L are they're not even sold today.
Oh, okay.
They're old plans. You're never going to find them. Most companies don't offer them.
Okay, so these are just the plans that are out there, but you're recommending people get G.
Yeah, the two plans that are the most popular are G and N. N is a little bit less expensive than G. It's a good plan. It's going to do the job, but you see it has the word copays on there. Yeah. Under G, I told you before that once you hit your $257 deductible, you're done. Under N, if every time you see a doctor, either at a hospital or in his office, it doesn't matter, there's a $20 copay.
Okay, so this is a lower premium.
Lower premium plan because there's greater out-of-pockets.
Right.
That's right.
So G covers, this is a supplement plan, G covers the 20% that's not covered under Plan B, doctor plan, traditional
Part B.
Part B.
Yes.
Traditional Medicare. Okay, I'm getting it.
Got it.
Takes a while to get this.
Yes. It is a little confusing.
It is confusing. So Mario, you want to sum this up for us?
Yeah, the summary is that you really should. The most important advice I can give to somebody is get good counsel.
Yeah.
And the second most important part is get it early.
Yeah.
You should be ready to apply 90 days before your effective date, which we know is the first of your birth month.
Got it.
Don't wait longer. You could get away with it 2 months within, 1 month within, but you're really rolling the dice because you're at the mercy of the individual at the Social Security office who's going to process your application.
Right, right.
So you want to get things done calmly. Second thing is, I would really try to understand the differences between a Medicare supplement and a Medicare Advantage and see which is best for you.
Medicare supplement being traditional Medicare plus
a private supplement.
Private supplement, which is also called Medigap.
That's right.
Yeah.
Versus Plan Part C, which is the
Medicare Advantage.
Medicare Advantage plan.
Right.
The next step is I would definitely pay attention to the prescription drug plans, Part D.
Mm.
You can go ahead and spend a little time. You don't have to create a username or password. Anybody listening to this can go right now to medicare.gov and play around with the site. It's very easy to navigate. And if you want to look at your prescription drugs, you click on the Part D button. You can enter the drugs.
Right.
And you can go ahead and play around with that. I've had situations where, let's say, a client takes 4 not too expensive drugs, but they take one very expensive drug.
Right.
And then they put it into the machine and it makes them choose a very high premium plan. Well, there's other services such as GoodRx, SilverCare, all these Amazon
Right.
online pharmacies that you can purchase medications at great discounts. So sometimes we purchase the one expensive medication using GoodRx,
Right.
and then we save a lot of money on all the other medications by choosing a very inexpensive or maybe even a zero premium Part D plan.
Right. That's a very good point, because a lot of people use GoodRx to save money, and they don't have to worry about their Part D, whatever the Part D charges. Or for
That's
'cause
right.
Some of the PBMs that manage these drugs really make a tremendous amount of money on some expensive drugs, and there are other sources to get uh, better treatment on your out of pocket on these drugs.
Right. You have to search. Sometimes I've even referred people to Canadian pharmacies, online pharmacies. They're totally legitimate.
Right.
You need a prescription. You can buy 90-day supplies. They sell generics. They sell name brand. But listen, it's no surprise. In America, we pay more for our drugs than other places in the world.
Yeah.
Same medications.
It's I guess that's something that Mark Cuban's been looking at and
Yes.
trying to work on as
Yes,
a private citizen.
I hope things come normalize as time goes on, but right now they're still pretty expensive.
Yeah, I'm on one really expensive drug, and I always tell the pharmacy, check out what the price is on a GoodRx for this drug, and give me whatever, and GoodRx is free. You can sign it up for nothing, and it's a great way to save some money on
I've used
expensive
it
drugs.
numerous times for myself.
Yeah, it's a good idea. So anyway, we're going to have these slides will be up on our website, Seniors Need to Know, and for any follow-up questions for Mario, we're gonna post his email address, so you can send him a question if you have a question or need advice from him. It's BICinsuranceconsultants.com, but we'll have that right now. We'll superimpose it on the screen so you can take it down or look at it later, and you could, Mario would love to help you and answer your questions, and he's been a great resource to me personally. So I've learned a lot, and I'm still learning a lot about the alphabet soup and the deadlines, and it's a lot to take in. So start working on it now.
Good advice.
Okay, thank you, Mario.
Thank you, Joe.